Penn Medicine is located in Philadelphia. We are a medical teaching facility. We have multiple hospitals in the area, Pennsylvania Hospital, Penn Presbyterian, University of Pennsylvania. We do about 1,000,001 images, radiology images a year, and we're a recent Sectra client. So we had started searching for new PACS related to the current PACS that we were on was not meeting the needs of the institution. Plus, with the added growth of the added hospitals, we needed a strategy where we could continue to grow and rely on that vendor that was going to support us going into the future. Additionally, there were some other pieces that were important to us in that the vendor that we did choose also has some pathology stuff that our lab is very interested in. And so we thought it was time to change vendors. And we had been with the other vendor for over 20 years. We had a lot of mini PACS. So we had mammography PACS, we had ultrasound mini PACS. So we were trying to consolidate some of those other systems into one platform, which makes support better and certainly reduces our operating costs as we reduce the systems that we have to support. We also were looking for strong integration with Epic. So our physicians do a risk-driven workflow, and so we were looking for someone that had a good partnership with Epic and that their integration worked smoothly. So what we actually deployed was mammography, which replaced other mammography systems at our location. We replaced our ortho 2D system, and we rolled out 3D as well for the trauma docs. We also rolled out Sectra dose tracking, which replaced another dose system that we had, and we hope that we can replace other systems as we move forward. We did this PACS implementation in a very short period of time. We signed last March, so it was a 6-month install to our first site, and we were going to do a phased site implementation so we could keep our old PACS running at other sites, and at the new site we would bring up the new PACS. And so we started in September. Shoulder support for the docs for 2 to 3 weeks after go live, and then we'd move on to the next site, leaving behind my staff to help support. There are always going to be questions as even after 3 weeks, even after 6 months, there's still questions that come in. And so we had 4 hospitals to get through, plus our outpatient vendor at DCR. And so that the go live went from September to about November, and we hit everything pretty much on stride. And I think it was fairly smooth for the physicians. They were very happy, and the techs picked it up very quickly for their tech workflow. So, docs if the doc sits for more than 15 minutes for training, we're lucky. So we try to get all the docs for an hour to get the basics. Docs have probably seen 2, 3, 4 systems in their lives anyhow. So there's some of the features are similar in nature. But I think the shoulder support, where we inundated them in their reading rooms with Sectra support. When they had questions, there was someone there to talk to them. And if not, we would bring somebody to them if they were in a different location. So I think that shoulder support was very important for them to get comfortable with the system. We also did a phased approach. As we kept at an institution, we would turn over 5 or 6 diagnostic workstations, and they would start working on Sectra while we're still working on our other platform. And so they weren't forced. It was within a week we would turn everybody over. And so, they weren't stressed, like everybody's on it today, and that's the way it's going to be. And so I think that helped a little bit too. We had to do a fairly large migration. We have about 10 million studies. We didn't quite understand how Sectra would understand or have in their system these studies. So we gave them all our SUIDs. So we thought, they know about all the studies. Well, it isn't quite that simple. They actually need to see all the studies being sent in, the real image. And so that was a learning process throughout the summer. So at time of go live, we had about 2 million studies that we had to migrate it, and we continued to do prefetch to continue to backload those studies as we move forward. So, it's a learning process, or sometimes it's a hearing process to make sure you hear exactly what they said. Every place has its own process. Every place has its own personalities. I am very comfortable with the decision that was made at Penn to select Sectra as the PACS. A couple key things. How can you support it? Is it easy to support? So far, it's been fairly easy to support. The uptime, we have had no 100% outage of the system. But also, when you put a question, if there's a problem, someone's there and follows up. The support has been very good. That this is a problem, and this is how you go fix it, or here's what we need to look at. So things don't necessarily get dropped. I think they stay on top of that, and they want to keep that communication going. So I think with the vendors, I mean, they also want that. They want a relationship. They want to know what you're thinking and where you're heading. I think a close relationship is to understand where the company's going and where your health system's going, and do the two really go together as they move forward, because that may not be the case with some, but I think it is the case for us right now, and hopefully it continues to be that way into the future.